Okay, so my name is Will Hsiao. I'm an associate professor in FHS. I joined FHS in September 2020, so that's right during the pandemic. So I've been here for about a year and a half now. So I'm trained as a microbial genomic scientist and a bioinformatician. So my research centered around the use of information or informatics to understand pathogens. And in the last 8 years or so before I joined FHS, I was the chief bioinformatician at BC Center for Disease Control. So through that role, and my research have mainly been to apply microbial genomics to the understanding pathogen surveillance in public health. So during my time at BC CDC, one thing we realized is that while we can generate a lot of genomics data using high-throughput sequencing and the new sequencing technologies that are being developed, the bottleneck has more to do with the contextual information, in other words, the epidemiological information that's available to help interpret and to understand the genomics. As a public health practitioner, I found that the lack of contextual information and the fact that they're collected inconsistently across the world create a bottleneck for the use of genomics and analysis. My lab currently, besides focusing on genomic analysis, also focusing on the area of knowledge engineering, which is to say, how do we improve the data quality? How do we create robust data representation models to capture the information and to manage the information? So I like to think that even though no one likes to clean up data, we're making that process easier. Develop some tools that help to capture information more consistently. And so that tool is currently used across Canada for gathering SARS-CoV viral genomics information and the associated minimum contextual information. Then that information is collected from the provinces and then sent to the National Microbiology Lab. So they get high quality data for their operation and research needs. So I have a fairly interdisciplinary group. Right now we have about 20 individuals in the group. Different people are working on different things, so I gave them sort of a wide range of options. Obviously you have to be something aligned with the research interests in the group, but overall they get to sort of shape their own thesis project a little bit with the idea that you take ownership of your project and you take ownership of your study, with myself but also others in the lab providing a peer or mentorship support. So I'm looking for students who are self-motivated, independent, and don't afraid to want to be in a very interdisciplinary environment where you're kind of forced to learn new things all the time, right? I also want students to know that they can't learn and do everything on their own. So another important attribute is that the student need to be willing to collaborate with other people and to work with other people. I'm not looking for a lone wolf or superstar type of students. I want people to work with each other because I think that's where true innovation comes from. The advice I receive and I also give to my students is that, you know, if you feel you're in direct competition with another group or another person or another researcher, then maybe you're not thinking or being creative enough in solving your problem, right? We don't all need to be doing the same thing. So that also sort of shaped my own research direction a little bit. I'm not chasing after the really hot topics. Rather, I'm very interested in how do you fundamentally shift the paradigm of research? How do you improve data sharing? How do you improve data management, right? These are indirectly supporting research, but they are nevertheless important research on their own. And I found too few researchers doing this kind of work because everyone wants to have the next biological insight, biological finding, but then without being able to aggregate data sufficiently, you're not really getting enough data to solve the really complex problems. And public health problems are usually multifactorial, complex problems that when you only look at a small data set or a slice of the information, I don't think you're truly getting to the core of the problem and come up with innovative solutions. So I did my PhD here actually at SFU in the early 2000s, and at that time none of the sort of university area was really built up, or just starting with the cornerstone building and so on. So coming back to SFU, I really enjoyed the much more vibrant community here. And related to that social interaction, the important attribute that I've seen at SFU that's not usually met at other universities is that there's a lot more collegial interactions and a lot more interdisciplinary interactions. There's a lot more people willing to listen to other people's work, hearing about other people's work, rather than pigeonhole in their own very narrow specific research area. So I really love that interaction, and that kind of reflected my interdisciplinary research as well.